we are using this machine very long period of time, so it's quite
Mm-hmm.
safe for your father, and it will
Mm-hmm.
also help to improve the blood circulation of your father, as you know that he is bedridden, and
Mm-hmm.
it will avoid the pressure ulcer also, and it is easy to move your father from bed to chair, and as well as the safe for to give a shower of your father. So
Mm-hmm.
it's quite safe and no need to worry about this lifting machine. Are you able to understand, Mr. George?
Yes, I understand that.
Okay. Do you have any other concern?
Yes, I'm a bit worried about his privacy. I hope that's maintained.
Yeah, of course, Mr. George. We know the patient have a right uh, to have their privacy. We are all responsible for to provide maintain his privacy by we are giving providing these curtains, and as well as whenever need we can close the door also. So no need to worry about the privacy. Okay.
Okay, all right.
Am I clear to you?
Yes, it's clear. Thank you.
Okay. Okay. Do you have any other concern, Mr. George?
No, I guess it's clear to me. Thank you.
Okay, thank you very much, and I wish your father speedy recovery.
All right, thank you. So, Savita is also there?
Yes,
Uh,
ma'am. Yes, ma'am.
Yeah, Savita.
uh, uh, Good morning. I'm Savita. I'm the nurse in charge in this nursing home. How can I help you?
Yeah, my name is John, and I am here to visit my father. I just met him. His
Mhm.
name is John Kin, and I noticed
Okay.
that he wasn't that comfortable with the nasal tube. So I just need to know that is there any other alternative for that?
Yeah, well, Mr. John, I can understand your feeling, how stressful being a son, how stressful the situation will be for you. And I hope you are aware about your father's situation. Okay.
Okay.
Then, Mr. John, the you are the patient. If I'm not wrong, you are the son of Mr. John Keane, who is in
Yeah.
Battery. Okay, then
Yes.
I'm talking to the right person about the right patient, right resident. Okay,
Yeah.
then uh, you know that you already understood about your patient, your father's condition, and
Yeah.
he diagnosed with a stroke, and he is not able to have food, chew, or able to eat properly. And
Hmm.
for, I strongly suggest that this is the best option we can offer him right at this moment, because that particular with a particular situation, your fathers may get choked when we feed him orally, and this tube which we inserted through your through his nose extend up to his stomach, so that we can give or all the oral liquid or all the feeds like juices or soup, uh, that
Hmm.
kind of liquids to come did- to finish his appetite, and in which improve his health status also, and nutrition, especially the nutrition maintenance of his.
Hmm.
Okay. Then as your father's uh, condition improve, we can remove that tube. So no need to worry. Right at this moment, I know that it gives him some difficulties, and we'll hope that we soon we can remove that.
Hmm. Okay. All right. And
Then
another is I noticed that he was lifted up by some machine. So is it safe to use?
yes, of course, the machine lifting machine is very much safe for all our residents. because we are using this machine for quite long time. We all are expert in use of this machine. And as you are well aware of your father, and for giving some nursing care, good care, nursing care, we need a good manpower also. So in order to reduce this manpower, the lifting machine is very helpful. And with this machine, we can easily transfer your father to for a shower to washroom, or we can make him sit on the chair. And
Mm-hmm.
apart from this, and we can give some soothing massage on his back, so that we can
Mm-hmm.
prevent all the ulcers.
Yeah.
Generally, this kind of situation may give ulcers to the patient.
Mm-hmm.
So we can reduce that.
Okay.
We can promote that. Okay. Then any other concern which I need to clear?
Yeah, I was a little bit worried about his privacy.
Okay. I know that I know this. I know the I acknowledge your concern, but see, Mr. John, you can see all the doors and curtain which we are provided here, and we are assuring his privacy. We are valid that at any moment all our residents need privacy. So we are closing the curtain before proceeding with any procedure, and if the moment we feel like the patient need extreme privacy, so we are assured to shut the doors of before the procedure itself. So in that moment, in that in that way, we are all maintaining their privacy. We are giving utmost privacy for our patients, including your father. So no need to worry. I hope you got my point.
Yes, it's clear to me. Thank you.
Thank you. I wish you a
Okay.
speedy recovery for your father. Thank you for your time. Thank you.
Okay. Fine. Hmm.
Okay,
Okay, that was fine. Yeah. Yes, Renu.
Yes, ma'am. Good morning, ma'am.
Good morning.
Shall I start, ma'am?
Yes.
Okay. Good morning.
Morning.
Yeah, what do you prefer to be called?
John.
Okay. Uh, okay, John, good morning. I'm Renu, working as a registered nurse in, oh, sorry, ma'am. Uh,
Mm-hmm.
Good morning. I'm Renu, as a nurse in charge in this nursing home. So, uh, you seems to be anxious. Do you have any concern regarding your father?
Oh, yes. Basically, I met him and I noticed he wasn't that comfortable with this nasal tube. So I just want to know that is there any other alternative for this?
Okay, yeah, I really understand your concern. See, Joan, I would like to tell you that see, he had a stroke. Am I right?
Yes.
Okay, then he's not, and in this situation, he's not not able to take orally. So we put this nasal tube. So we put in through the nostrils and put in the stomach. So
Mm-hmm.
he can easily meet his nutritional requirements. We will give food from this tube,
Mm-hmm.
and this tube also prevents choking. So if he'll take in this situation, if he'll take orally, then there will be chances of aspiration. So
Okay.
and this will be very dangerous for his health. So that's why we put this NG tube, and it's quite safe for him at this time.
Mhm.
Is it
Okay.
clear, John?
Yes. Yes.
Okay. So do
Okay.
you have any further
And
concern?
yeah, I noticed that he was lifted up by some machines. So is it really safe to use?
Yeah, of course, it is safe. This lifting machine, actually, we are using this lifting machine for this kind of patients who are bedridden. So this
Mm-hmm.
machine is helps in many ways. So patient because we are not allowed to lying down patient for all the time, so this machine will help to get out from the bed and from
Mm-hmm.
bed to chair, and he can go to the shower with the help of this machine. So and it's also improve his blood circulation, which is very important in the hospital, because there will be chances of blood clots, there will be the chances of pressure ulcer. So this lifting machine will helpful for to protect from these conditions. Is it clear?
Mm-hmm.
Uh, am I clear to you?
Yeah. Yes, that's clear. Okay.
Okay.
And I hope his privacy is maintained.
Yeah, I really understand your concern about privacy. See, Joan, I really want to tell you that we always maintain privacy for each patient, because this is very important for patient also. So when we are doing any procedure, so we always drawn the curtains and shut the door, because it's also important for us also. That's so no need to worry about privacy. So we always maintain the privacy for each and every patient. Is it clear,
All right.
Joan?
Yes, that's clear to me. Yeah, thank
Okay.
you.
Thank you so much and wish him a very speedy recovery. So you can call me anytime for your further assistance.
Okay, all right, thank you.
Okay, ma'am. Thank you.
Yeah, that was really good.
Okay, ma'am.
Okay, Sukhveer,
Okay, ma'am. Good morning.
good morning.
My name is Sukhveer Kaur, and I am the nurse in charge in this nursing home. How
Mm-hmm.
may I address you?
You can call me John.
Hi, John. How are you doing today?
I'm good.
Mm-hmm. Have you met with your
I
father today?
Yes, just now, and I have few concerns related to that. Is it the right time? Can I discuss?
Yes, please. You can proceed.
All right. So firstly, I noticed that he wasn't that comfortable with the nasal tube. So is there any other alternative for that?
Okay, I understand. Well, I understand, John, that it must be very difficult situation for you to see your father in this situation. And but let me reassure you that these are the best things which we are doing for your father at this moment. Okay?
Mm-hmm.
Yeah, and firstly, I would like to talk about the nasal tube feeding. So, do you have any idea that why we are feeding him on a nasal tube?
Um, yeah, I know that he is not able to tolerate the take the things orally. But
Mm-hmm.
I want to know that is there any other option for that?
Okay, all right. I appreciate your knowledge, Mr. John, that you know that why we have inserted the nasal tube for your father. So as you know that your father has a brain attack. So in this situation, your father is not tolerating any oral fluids by himself. So just to fulfill all the nutritional requirement which is very mandatory for your father in this situation, we are providing him we are giving all the nutritions and fluids and medications through the nasal tube feeding. And
Mm-hmm.
moreover, the advantage of this feeding is that it prevents choking, as your father is not much conscious. So I hope you understand.
Yes, I understand that.
Hmm. And beside this, I'm afraid to say you that there is no any alternative at this moment. You have to cooperate with us, Mr. John.
Okay, all right. And what about the machines that I noticed he was lifted up by that? Is it really safe to use?
Okay, let me explain you that the lifting machines, are very helpful. They are quite safe, and they are specially designed to mobilize the patient who are means independent, who are dependent on others. So in your father's case, it's really very important to shift him through the lifting machines. It will help to improve the blood circulation. Along with that, it help us to transfer him from bed to chair, and if he needs to shower. So don't worry about the lifting machine, Mr. John. It's really very safe, and there are extra paddings which are which will not hurt your father and prevent from the injury also. Is it all
Oh,
right with you?
all right. So I hope his privacy is maintained.
Okay, yeah, exactly. For us in this nursing home, we respect every patient's privacy, and it's really very important for us. So,
Mhm.
while doing any procedure, I think you when you visit there, you have seen that we always draw the curtains and shut the door. Have you noticed that, Mr. John?
Yeah, yeah,
Mm-hmm.
that's right. Hmm.
So that is a thing which we all nursing professionals do in this hospital. While doing any procedure, we shut the door and draw the curtain, so that means the patient will not feel awkward, or the relative will also feel safe. I
Mm.
hope you are getting my point.
Yes, I understood that. Well, thank you so much for your time, and I got the clarity.
Okay, well, I hope I cleared all your doubts, and please don't worry. Let me. At last, I would like to reassure you that your father is in a safe hands, and he will be get means he will recover sooner.
Yeah. All right.
Okay, I wish
Thank
your
you.
father a speedy recovery. Take care.
Yes, thank you. Okay, I believe that everybody did a good job in this task since it was, you just need to answer his question. But yes, apart from that, that is also important that you need to convince. And see, it is easy to get B grade 350 score, in this task, but how you will score more than B, it depends how easy you explain to the patient. For example, when he asks about the NG tube, then you have to explain, well, as you know that your father had stroke and he's not able to tolerate the things. So it is very important to give him something by mouth to maintain his nutrition status. So this is the only way to provide him the food and maintain the nutritional requirements. And moreover, this prevent choking, because if we'll give something by mouth, this that can go into the windpipe and there could be some emergency. So to avoid the choking and to maintain a nutritional status, this is the only safest way. However, there are some surgical ways so that are not usually recommended. I hope it's clear. So, and second, like machines, you all said, you somebody of you said, shifting this for manpower and all. I think if that is not given, no need to say. I think Savita, you said, so keep that in mind. It's given the 3 points are already given here to explain. Machine is safe, improve blood circulation, easy to transfer. So that's what you can say, that 3 points are already given. That I understand your concern, but let me reassure you, these machines are really safe to use. We are using it since a long time. And it is basically used in, especially in this type of a situation where the patients are bedridden, because this improves the blood circulation and to avoid the pressure ulcers, which is very common when the patient lie down on a bed for a long time or a bedridden. Moreover, or you can say apart from that, it helps in ambulation, especially when from bed to chair and chair to bed, and even we have to transfer the patient for the shower. So it helps in all these things. Okay. So I would say that it is very imperative. So don't worry about the safety of that. Okay. And issues. You all said the curtains are always withdrawn, the door is shut. So we maintain this is our utmost priority, and privacy is the most important thing for everyone. So, and we maintain that very well. So don't worry about that. So that's it. So basically, how easy you explain, the more score you will get. Is that clear?
Ma'am, in
Yes, ma'am.
between, I just said that in this kind of patient may get bed sore. So is it good to call
This
patient?
kind of a patient, don't say this kind, say bedridden patients usually get depression. There are more chances of having that. So to avoid this, we use this machine so that it do the as it improves the blood circulation.
Okay, in between our talk, we can use that word patient. So I thought he is a resident of our uh,
Yeah.
center city, so we need to call by name only. Or
No, no, but while patient, he's not a patient, he's a attendant.
uh,
So,
so
but you
to
have to
him we
explain,
can
you can say the patients.
okay. Say, okay,
Okay. And
okay, ma'am.
manpower, the thing is, ideally we say this for this machine. I know that's the reason, but it's not given. So better the points which are given, discuss that only.
Okay, okay.
Okay, I believe it's clear to everyone.
Yes, ma'am.
Yes.
Yes.
Yes,
Great.
ma'am.
Okay. So can we move to the next one, the topic 33? Chino, you have two
Sure, ma'am.
minutes. Okay, Chinu, you can start.
Okay, ma'am. Good morning.
Morning.
I'm Chinumol Babu, one of the registered nurses working in this hospital day procedure center. Please take your seat.
Hmm? Yeah.
How may I address you?
You can call me Tina.
Okay, Tina, you look so nervous. What happens to you?
Yeah, so I'm actually terrified with this situation of having this test. So I don't know. The doctor said that I have to undergo this gastroscopy with the barium meal. So I'm just worried about that and actually scared of that because my grandmother died with some stomach trouble, and I'm wondering if that could be the case with me.
Oh, I'm very sorry to hear that your grandmother died due to some gastric problems. But don't worry, Miss Tina. I can understand your concern also regarding your abdominal pain. Um, I gone through your medical records. So you have some abdominal pains for few weeks, and the doctor said for the treatments. Am I right?
Yes.
Before moving on to that, could you please tell me regarding your pain, where the pain hurts?
No, I have the stomach pain.
Okay. Mm, so don't worry about this pain, and we are here to help you for that. And we have some procedures. So we will identify the actual the cause of your pain. Okay.
Hmm.
And also, don't worry about the cancer. This is not a symptoms of cancer, and it may be due to some indigestion or any ulcer. Okay, so when your the pain is come after you're eating or your before your meal.
No, this is a constant pain.
Okay, I'm sorry to hear that, but don't worry, Miss Tina, and your doctor advised for your gastroscopy and meal. Okay, so
Hmm.
you have any idea regarding this test?
No, I don't have an idea.
Okay, I will explain you in detail first. Firstly, I will explain you in a Iberian meal. Okay, so we will give you some liquid, and after that you will swallow, and we will take your X-ray, so we can identify the actual diagnosis of your abdominal pain. Okay.
Mm-hmm. Mm-hmm. Okay, all
And,
right.
and secondly, the doctor advised for you the gastroscopy. Okay.
Mm-hmm.
It means the one gastroscope inserted in through the mouth, and through the camera we will visualize your all the abdomen, so we can find the diagnosis.
Mm-hmm. Okay, all right.
uh, don't worry about this two procedures. It will not take a long time, and it will not have any side effects also. Okay.
Mm-hmm. Okay.
I can understand it's a hard situation for you, and you are going under this first time. But don't worry, we are here to help you for that. Okay.
Sure. Thank you.
So, okay, thank you. Then only we can identify your actual diagnosis. Don't worry, Miss Tina. Okay.
Mm-hmm. Bye.
Okay. Are you willing to do this procedure?
Yeah, that's okay.
Okay. Thank you. Thank you for your willingness.
Okay. All right. Yes or no?
Good morning.
Morning.
I know I am one of the registered nurses in this daycare procedure. For the better
Mm-hmm.
clarification, may I know your name, please?
Yes, my name is Tina.
Okay, Miss Tina. You look so anxious. What happened to you?
Yeah, actually, I'm just worried about this test which the doctor said gastroscopy. I'm a bit worried because, I'm scared actually. My grandmother had some stomach issue and she died with that. So I'm wondering if this could be a cancer.
Okay, Tina. I am very sorry to hear that your grandmother had died with cancer. But you know, Tina, nothing to worry about this. Okay, uh, your abdominal pain may be because of some other reasons. Okay, it can be happen because of indigestion, gallstones, or irritable bowel syndrome, or maybe because of the ulcer. Is that clear?
Okay, all right.
Okay, so no need to worry about that, and we can find out the exact reason after doing these tests. Okay. Uh, do you know any idea? Do you have any idea about this gastroscopy and barium meal?
No.
Okay, don't worry. I will explain you in detail. Okay. Uh, Firstly, regarding gastroscopy, you know when we do this procedure, we use a thin, flexible tube. Okay, this tube um, at the end of this tube, a camera is attached. We will insert this tube through your mouth so that we can visualize inside your stomach. We can
Mm-hmm.
find out if there is any problem in your stomach. Okay.
Mm-hmm. Mm-hmm. Okay.
And secondly, regarding this barium meal, uh, we will give a medicinated drink. Uh, First, you have to drink it, and then we will take an X-ray or CT scan. In that CT scan or X-ray, we can see if there is any problem in the stomach. Are you following me?
Yeah. Okay.
Okay. Uh, do you have any other concern, Gina?
No.
Okay. Once again, I reassure you that nothing to worry about anything. We have experienced doctors in our hospital. We will find out the exact reason for this test and we will provide you a better treatment for you. That sounds
Mm-hmm.
okay to you?
Yeah. Okay.
Okay. I hope I have cleared all your doubt, is it?
Yeah. All right.
Okay, Gina.
Okay. I know that was good. Okay, Anjali. Anjali, you need to unmute. Lissy, you can unmute yourself.
Yes, ma'am.
Okay, so you can start.
Good morning.
Morning.
I'm Lissika Krishnan, one of the registered nurse in daycare center. I
Mhm.
can see that you are so nervous. Could you please tell me what is bothering you?
Well, yes, I'm worried about my test which I'm undergoing. I'm actually feeling scared because my grandmother died with the similar kind of a problem.
Okay.
So I'm scared if this could be cancer.
Okay. So, for better conversation, could you please tell me your name?
Tina.
Okay. Okay, Miss Tina, I'm really sorry to hear that your grandmother is passed away due to cancer. But I totally understand your feelings. So no need to worry because you are having abdominal pain. There are many other reasons for your abdominal pain, like indigestion, some stones, as well as the ulcers, and you may have due to over stress, you get the irritable bowel also. These all symptoms may be due to these all problems are associated with this abdominal pain. Okay, so
Mm-hmm.
no need to
All right.
scare. Be think positively, and the doctor will till the doctor will diagnose for better and give the better treatment for this abdominal pain. Okay.
Mm-hmm. All right.
So I can see that the doctor has prescribed you for gastroscopy and barium meal. Do you have any idea about this test?
No, I don't know.
Okay, don't worry, I can explain to you. Um, Firstly, the gastroscopy is a procedure in which the tube is inserted through by our mouth and into the stomach. So the doctors can visualize and take the pictures, and they know the idea about if there is any abnormalities they can find out. Okay,
Mhm.
it's a
Mhm.
simple procedure. No need to worry about this procedure, and it's quite safe for you. Okay.
Mhm. All right.
Secondly, this barium meal in which uh, we are giving the some medicine that you have to drink, and after that you may go for the X-ray. So different type of X-ray, abdominal X-ray will take, and the doctor can find out the any the reasons for this your abdominal pain.
Mhm.
So it's painless procedure, and it's a simple procedure. Okay, you no need to worry and scared about this test.
Sure.
Are you
All
understand,
right.
Miss Tina?
Yes, I understood that. Thank
Okay.
you.
So, Tina, I'm here. I'm reassuring you. Don't afraid for your condition. It's quite normal, maybe due to your stress and other conditions also. Hope for the best. The doctor will decide and diagnosis after this test. Um,
Mhm.
so, no need to worry. Be confident and think positively.
Sure. Thank
Okay.
you.
I wish a speedy recovery for you.
Okay. Yes, Savita.
Uh, Good morning. I'm Savita Vasu. I'm one of the registered nurse working in this procedure center.
Mm-hmm.
How can I help you?
Um, Basically, I'm concerned about my test, which is, I have to undergo today. So I'm just feeling scared that, you know, my grandmother actually died with the cancer with a similar kind of a complaint. So I'm worried that if it could be like that.
Okay. Okay. Before going further, how can I call you?
You can call me Tina.
Okay. Tina. Okay. I have your. I know that. I'm sorry to hear that your grandmother died with cancer, and
Mm-hmm.
you are having abdominal pain for few weeks. And no
Mm-hmm.
need to worry. I know your how the stressful situation will be for you, and no
Mm-hmm.
need to worry. Your abdominal pain will be with some simple causes also, like it may be with just with the indigestion of some food, or maybe with some gallstones, and it may be because of the bowel pattern changes also may cause abdominal pain, and no need to worry. Anyway, we are I hope you are came with all the preparation for the investigation
Yes.
procedure. Okay. Do you have any idea what the assigned procedure for today?
Yes.
Okay. Then anything else which I need to explain you regarding that?
No, nothing.
Okay. Then if you already aware about the gastroscopy or barium meals test, and gastroscopy is a simple procedure as
Yeah.
uh, uh, with a small tube with with a small camera at the tip of that, and which you need to swallow through your mouth. It's extend up to your stomach, and with the help of that camera, your doctor can see what's actually going on your food pipe.
Mm-hmm.
And
Okay.
it will give a nice picture about the internal condition of your food pipe, so we can easily get a diagnosis. And the second thing which need to know about, which I need to explain about barium meals. This is a quite safe and procedure. You need to drink a water-based dye, and which give a clear-cut picture of your blood vessels, and by taking an X-ray after drinking this dye. So this is a say painless procedure, and you don't need to worry about this procedure. And I hope you done all the procedure uh, preparations. Um,
Yes.
okay. Then, Miss Tina, no need to worry. And as you said that you are worried about the abdominal pain, and I am reassuring you that uh, be confident in your life, be positive. And there are some, we know, I am working here for a quite long period, and I know all the abdominal pain are no need to be land up in such a dangerous situation like cancer. So
Hmm.
uh, be optimistic in life.
Sure.
Okay, wish you a
Thank
speedy
you.
recovery. Thank you.
All right.
Okay.
Yes, Sukhvir.
Okay, ma'am. Good morning.
Morning.
My name is Sukhveer Kaur, and I'm the nurse on duty in this hospital day procedure center. How may I address
Mhm.
you?
Tina.
Sorry, ma'am.
Tina.
Well, Tina, you look so anxious. Could you please tell me that what's bothering you?
Yeah, I'm a bit worried about this test. I'm actually feeling scared because my grandmother died with a similar kind of a situation, and she died, and I'm wondering if it could be cancer.
Oh, I'm so sorry to hear that. Uh, but don't worry, Miss Tina. I'm here to help you. And let me reassure you that all the abdominal pains are not cancer. There could be many other reasons, like maybe the pain is for indigestion, or there may be a gallstones, or irritable bowel syndromes and ulcer. So means there are various reasons for the abdominal pain, so don't think in this way. Okay.
Mm-hmm. Okay, all right.
Yeah, and I understand from your case notes that the doctor has suggested you with some test. Is that right?
Mm-hmm. Yeah, yeah,
So, do you have any idea that what this tests for, how we
yeah.
perform it? Okay, don't worry, Tina. I will explain you about this test. These are the quite safest procedures, and these are only to rule out the condition. Okay. So,
Mm-hmm.
firstly, I
Okay.
would like to talk about the gastroscopy. So, in this, we use a flexible tube which we insert through the mouth to look
Mm-hmm.
inside your food pipe, just to
Mm-hmm.
find out if there is any abnormality or any problem. Are you getting
Okay.
my point?
Yes.
Okay. So secondly, so now I would like to talk about the barium meal. So barium meal is a imaging study which we do with the help of an X-ray, just to
Mm-hmm.
visualize any difficulty or any problem in the stomach, in the uh, food pipe, or any other nearby organs. I
Mm-hmm.
hope you understand that what I want to explain you.
Yes, that's clear to me.
Yeah, and I would strongly would like to tell you that Miss Tina, there is nothing to be alarmed about, and you are in a safe hands now. This test will definitely help you to rule out the condition which you are suffering from. Okay.
Mm-hmm. All right. Okay.
So apart from this, do you have any other concerns?
No, that's clear.
Okay, well, I hope I cleared all your doubts. And meanwhile, you can take rest, and I will be back with the consent form, which you have to sign before the procedure.
Sure. Thank you.
Okay, take care. I wish you a speedy recovery, Tina. I will be back.
Okay, that was good.
Okay, ma'am.
Yes, Kulvinder.
Okay, hello, good morning.
Good morning.
My name is Kulendra Kaur. I am one of the registrars that working in this procedure center. How may I address you?
You can call me Tina.
Okay, Tina, you are look so anxious. What is bothering you?
Well, yes, I'm worried about this test of gastroscopy. I'm feeling really scared because my grandmother died with a similar kind of a stomach pains which I have, and I'm wondering if this could be cancer.
Okay, I really understand your fear, Miss Tina. Uh, 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 I really understand your fear, Miss Tina, but before proceeding further, I would like to ask some questions. Is that okay?
Mm-hmm. Okay, all right.
Okay, please could you tell me about your social life?
Yeah, my social life is like normal. I don't drink and smoke.
Okay, okay, Tina. So uh, I can understand your concern. You have a stomach pain and you have feared it could be stomach cancer. But Tina, I suggest you the stomach pain. It doesn't mean it could be a cancer. So it may be related to some indigestion, gallstone, and irritable bowel and ulcer, etc. So don't worry about that. So your doctor has prescribed some tests to find out the exact cause of your stomach pain, and you doctor
Hmm.
prescribe some test gastroscopy and barrier meal. Do you have any idea about gastroscopy or barrier meal?
No.
So, don't worry, let me explain. Gastroscopy is a procedure. It's a painless procedure. It is a thin tube. Uh, it is a thin tube that insert put your mouth to a stomach and put a small camera in front of tube to visualize the exact cause of to find out the any problem. And regarding the barrier meal, it is barrier meal is a medicine. It is in a liquid form, and you can take this through mouth, and the doctor will take the x to find out the further problem. So I reassure you that both tests are very important for you to find out the exact cause of your stomach pain. So if you will take this, if you will be ready to do that, so doctor will find the cause and give you the appropriate treatment to prevent further problems. Is that okay?
Yeah, that's fine.
Do you have any other concern, Miss Tina?
No, that's really clear to me. Thank you so much.
Thank you, Tina, for answering the questions and take care.
Okay, that was good. Yes, Jules. Jules. Yeah, Jules, you need to
Good morning.
unmute.
Okay,
Morning.
I'm mute. Okay. Good morning. Uh, I am one of the registered nurses working in this hospital where the one day procedures are performed. So it's a
Mhm.
what can I address you?
You can call me Tina.
Okay, Miss Tina, what brings you here?
Well, basically, I'm here for the test. I have to undergo gastroscopy for my stomach pains.
Okay, fine. Now I understood. After going through the case sheet, I have came to know that you have some problems with your abdomen.
Yeah.
So you look so panic and anxious. What's the reason behind
Yeah.
that? Is anything apart from your
Yes,
abdominal pain?
basically I'm worried about my, this test because my grandmother died with a similar kind of a situation as she died with a cancer, but I'm really wondering if this could be that.
Oh, I'm so sorry. First of all, I'm so sorry to hear that your grandmother has passed away due to cancer in the abdomen. I'm so sorry. Uh, the thing is that in your case, all the abdominal pains may not result in cancer. First, you should realize that. So
Hmm.
it can be related to something like indigestion issues or ulcer, or it can be because of this irritable bowel or an ulcer. So there are many reasons for the abdominal irritability or the abdominal pain. So in your
Hmm.
case, doctor has suggested two tests which has to be performed now or today.
Hmm.
That one is gastroscopy. Do you have any idea what is gastroscopy means?
And I know that this is something to see in my stomach.
This is a simple procedure. Normally, it won't last for the more than 30 minutes. It's a simple procedure, and it's like a small camera is attached on it in the end of a tube, and that will be passed to their mouth. And this will be performed by trained and qualified doctors, and the staff also will be assisting you, and you will be monitored continuously even before the procedure, during the procedure, and after the procedure, and the exact diagnosis will be provided, and the provisional report also you can ask for. So you need not worry about that. The other test is barium enema. Do you know what is barium enema is?
And no.
This is also the second procedure what doctor asked for you. In this barium enema, they will give, or we will provide you with some sort of drink. So, that will empty your bowel, and so that after that an X-ray will be done. So your
Hmm.
internal organs will be visualized. So, is
Hmm.
there anything left behind, or something? Some comorbidities are there. It can be treated easily, so we can diagnose it. Um, so both the procedures are painless, and this will be completed in a day. Uh,
Hmm.
so
Okay.
you'll get the reports, and you can go home uh, peacefully. That's the most important thing is that you should not be panic. So that um, you're you'll be monitored by us. So be relaxed and stay calm. Um,
Sure.
and also be positive. Am I clear to you?
Okay. Yes, that's clear. Thank you.
So, okay, bye. Wish you a speedy recovery. Thank you.
Yeah. Thank. All right. That was good. Yes, Renu. Renu, I can't hear you, dear. I think there's some problem. Can you exit and join again? In the meantime, let me hear from Anjali. Yes, Anjali.
Good morning.
Morning.
My name is Anjali and I am one of the registered nurses working in this hospital day procedure center. How may I address you now?
You can call me Tina.
Okay, Tina, if you don't mind, could you please explain why you look so anxious?
Well, yes, I'm worried about my test as I know this gastroscopy and the stomach pains I have. But my grandmother had a similar kind of a condition and she died with that. So I'm really wondering if this could be a cancer.
Okay, Tina, I'm so sorry to hear that you are. mother has died due to cancer. But don't worry, Tina, about your condition. Not all our symptoms are end up with the cancers. Okay, Tina? Hello, ma'am.
Yes.
Uh, and your pain, your abdominal pain can be due to some ulcers or indigestion or some irritable bowel syndrome or any gallbladder stones. Are you
Mm-hmm.
getting it, Tina?
Yes, I understand.
And your doctor has suggested some investigation like gastroscopy and barium meal. Do you have any idea about this one?
No.
Don't worry, Tina. I will explain to you. The first gastroscopy. It's a flexible. It's a procedure. In this procedure, we are using a flexible tube. It will insert
Mhm.
from your mouth to your abdomen. And don't worry about this one. It's not. It will not cause any pain. And from this procedure, we will. It will give a clear picture about your abdomen.
Mhm.
Yeah. And second thing is about barium meal. It's
Mhm.
like a imagination study, imaging study like X-ray. In this procedure,
Mhm.
we are taking some medicine and you will swallow that one. After that, we will take the X-ray of your abdomen,
Mhm.
and it will
Okay. All right.
also give a clear picture about your abdomen, and you can find out what exact cause of your pain. Okay, Tina.
Okay. Okay. All right.
Do you have any other concern, Tina?
No. I guess that's clear to me.
And I strongly suggest you to don't worry about your condition and think positively. We all are here to help you, Tina. Okay?
Mhm. Okay.
I wish you a speedy recovery. Thank you.
Thank you. All right. Yes, Renu.
Yes, ma'am. Do you hear me, ma'am?
Yes, I can hear you now. Please start.
Okay, ma'am. Good morning.
Morning.
I'm Renu, registered nurse, working as a registered nurse in this hospital day procedure center. So, for the better conversation, what do you prefer to be called?
You can call me Tina.
Okay. Okay, Tina, you seems to be very anxious. So, could you please tell me what's happening in your mind?
Well, yes, I'm worried about this test actually. Um, I'm actually wondering if this could be cancer because my grandmother had similar kind of a problem and she died with that.
Oh, I'm so sorry to hear that. So, I really understand your concern, but I would like to tell you that not every pain, see, Tina, not every pain goes to that way, that belongs to cancer, that which you are thinking about that. It may be because of indigestion and some gallstones also can be present there, and due to some ulcers and irritable bowel, that which usually due to some spicy foods and outside foods. So don't worry about that. So is it clear, Tina?
Okay, all right.
And do you have any further concern, Tina?
Um, no, actually.
Okay, and I would like to tell you about some procedures which recommended by the doctors for you, which is gastroscopy and barium meal. So, have you any idea about these procedures?
No.
Okay, so Tina, I would like to, I'll explain to you what is this gastroscopy and barium meal. So in
Mm-hmm.
gastroscopy, we will put the tube into through the mouth into the stomach, which helps to visualize exact cause that what's going in your stomach. And in barium meal also, we will give you the some liquid form medicine,
Mm-hmm.
which helps to visualize the parts in your stomach that we can easily find out the exact cause that what's happening in your stomach. So is it clear, Tina?
Yes, that's clear to me.
And don't, I would like to tell you that don't worry about these procedures because these procedures are painless. Both are painless. So
Mm-hmm.
don't think about that. Okay, Tina? I hope it's
Okay.
clear to you.
Yes.
Okay, and in the last, I would like to reassure you that don't think in that negative way. Always be positive. So everything will be fine, and you are in safe hands. We are here to
Mm-hmm.
take care of you, Tina.
Okay. All right.
Okay,
Mm-hmm.
okay. Thank you. I wish you a very speedy recovery and get well soon. I will be here for your further assistance.
Thank you. All right, great. So that was good. I think it was a simple task, basically more emotional, psychological support. As you first asked that why she's anxious, she answered. Actually, how do you say your second sentence in this task is more important? So you just have to say, well, I understand your concern, but I just want to tell you that I just want to tell you that this is cancer is not only because of these symptoms. There could be various other problems like indigestion, gallstones, and irritable bowel and ulcer. So there are many, okay? There is a number of list of problems. So don't think that if you have stomach pain and it could be cancer. And I'm really sorry about your grandmother, but let me reassure you that there could be something else problem with your grandmother. Okay, I would suggest that be positive, undergo this test, and you will be fine. All right.
Okay. Yes, ma'am.
Yeah, so main emphasize on the second. You just have to reassure her that be positive and optimistic that this is not because of this. That's it. Okay?
Excuse me, ma'am.
Otherwise, you all did a good job. Yes.
Yes, ma'am. Ma'am, this is the third point. Ma'am, explain some of the tests to the patient. So, ma'am, in this
Yeah. So
task,
that's
you
what you
should
can.
explain.
Yes. Explain about the this gastroscopy and um, barium enema, barium meal. That it is
Okay,
just to
ma'am.
show there is any blockage or there is a camera like most of you said there's a camera to go inside and to visualize the stomach just in one line. Now a tube will be inserted
Okay,
through
ma'am.
the mouth and there is a camera at the end of that which will visualize the stomach and it will the barium meal will help to find out if there is any blockage or any tumor.
Okay, ma'am. Yes, ma'am.
Okay, is that clear to everyone?
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Yes,
Yes.
Yes,
ma'am.
ma'am.
Anyone has any questions in mind? Yeah. Okay.
Mom,
Yes.
in this task, the last we need to for consent, we need to tell about the consent. This procedure.
No, it is written reassure the patient. It is not written consent. Where's that?
Okay, then no need to mention. And some of
No, no, no. It is extra. What she said, that I'll come for the consent. No, no, no. That's not that important to mention. If you want to add, you can. They are not going to cut marks for that, but it's not given.
one more thing. When I in my task, when I asked you, you want me to explain about this
I
test.
said yes.
But you
Yeah,
said
I
that
said I already know. Yeah,
then
I
in that case,
purposely said.
what? How can we say that
Till you
we
did
can?
that, I said I know, but you still explained to me about the procedures.
Yeah, I know
So
that, but
actually, there is
I was stuck.
that has to be in a tricky way. You should say, well, I really appreciate it as you know about it, but I would like to add on more information. These two lines were important in that case.
Okay. Or then I told the Lissy Didi also. Then she said that okay, I acknowledge your knowledge, but I
Uh,
appreciate your knowledge,
Got it
but
directly. I know. I know.
it might pressure that let me explain you briefly about again. So
Yeah, you can say that. Yeah, but first
okay,
appreciate her knowledge. Yeah.
uh, I thought, why? How can I complete my task?
Yeah, I understand. That's important part of that. Yeah.
I also started explaining, ma'am, but you were not asking about the procedure.
Yeah. I don't have to ask. It is you have to tell me. In my task, it
Okay,
is
ma'am.
not written to ask.
But when I asked, do you have any further concern? So you didn't ask about the procedures.
That's what I'm saying. In my task in patient role, it is not written to ask that explain me about the procedure.
Okay, ma'am. Okay, ma'am. Yes, ma'am.
So I will not ask, but you have to tell.
Okay, ma'am. Yes, ma'am.
All right?
Yes, ma'am. Okay, ma'am. Got it, ma'am.
Okay. Any more questions? Now,
No, no.
Jose, I hope you are getting some clarity. Okay, guys, I
Yes,
just
ma'am.
want to update that tomorrow is a leave, Good Friday. Okay. And this is a long weekend. What will I do? I will share my writing criteria video again in the Skype group. So please
Mm-hmm.
listen to that. And based on that, I will share one of the letter which everybody has to write, and then we will do a writing mock test on Monday.
Okay, ma'am.
All right.
Okay, ma'am.
Regarding our writing, so we need to stick on the time for 40 minutes. We need to complete our task when we
Absolutely,
practice our.
absolutely. You have to be very genuine with the timings, everything. Mock test means mock test. But yes, for the beginners, there is an excuse. But those who have an exam, so be really particular about the timing.
Okay, ma'am.
Okay. All right. So
All right, ma'am.
take care. Have a good day and have a
Okay,
long
ma'am.
weekend.
Yes, ma'am.
Okay, ma'am.
Thank you,
Enjoy.
Thank you
ma'am.
so much.
Bye.
Same to you, ma'am.
Okay, ma'am.